you can offer many clinical decision support tools, apps, devices, and all of this stuff that's meant to improve care. And theoretically, it can. But if someone just does not have cognitive space to look at another piece of information or to open another app, it won't get used. And if there's no adoption, there's not going to be any impact.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional healthcare careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. In this episode, we are privileged to sit down with Dr. Kaeli Yuen, a trailblazer in the field of healthcare technology. Dr. Yuen's credentials speak volumes about her commitment to excellence and her relentless drive to incorporate informatics into medical practice. Having graduated from the prestigious Keck School of Medicine at USC in 2019, Dr. Yuen opted for a non-traditional professional career. Instead of pursuing residency, she took on a variety of different roles related to product management, advancement of system interoperability, and healthcare public policy through various startup ventures. She also obtained a graduate certificate in Biomedical Informatics from Stanford University. She has experience as a White House Presidential Innovation Fellow, where she worked directly with the Veterans Affairs to build out a better EMR experience, improving clinical practice on a national scale. She also played a pivotal role at Accolade Incorporated by serving as the Director of Strategic Business Planning from 2021 to 2022, and later as the Director of Clinical Product Management from 2022 to 2023. Driven by her passion for catalyzing change, Dr. Yuen embarked on a new venture, founding AltMD this year. AltMD is dedicated to empowering clinical trainees to pursue careers in health and technology, fostering a new generation of innovators. She continues to push the boundaries of what's possible, leveraging data and technology to enhance the delivery of care to our nation's veterans. Join us as we delve into Dr. Kaeli Yuen's journey, exploring the challenges she's overcome, the lessons she's learned, and the vision that propels her forward in shaping the future of healthcare today. All righty. Welcome to the show, Dr. Yuen. Happy to have you today.
Hi, Nathan. Happy to be here.
Excellent. And I think we have a lot of really interesting stuff to talk about today. And let's kick things off with the beginning here. Can you tell us a little bit more about your background and what initially led you to pursue medicine?
Sure. So pursuing medicine was something always on my radar, given that I come from a family of two doctors. Both of my parents are actually dermatologists. And there are a number of other doctors in my family, aunts, uncles, and so forth. So it's always something that I thought I might do. And that's, I guess, where I got the idea.
Awesome. So you had some early influence that kind of directed where you were going to go with that.
Mhm.
And so you kind of knew that you wanted to do medicine, but when did you start to take an interest in like bioinformatics then?
Yeah, I would say it was in college that I started to get interested in computer science. I took a few courses and I was interested, thinking about going that way. But I had also come into college thinking that I would go to med school afterward. So actually, after graduating undergrad, I was lucky enough to find a position that combined those two interests and helped me explore both without having to fully commit to either side yet.
Oh, that's really cool. What was this position? You're talking about during your gap year, is that right?
I took 2 gap years actually between undergrad and med school. I was working at the VA Palo Alto healthcare system in a research group that was developing clinical decision support applications for the VA's electronic health record.
Wow. How did you even find this opportunity in the first place? That's like really cool, like kind of gap year experience. A lot of people will just do like 1 year of research somewhere at some random lab or kind of continue on their undergrad exposure. So how did you find this opportunity?
Yeah, I mean, I really lucked out. I think I just found it on some job board that was associated with my college. And I had no idea about clinical decision support, clinical informatics, or anything like that beforehand, but it was vaguely computer science related. So
hmm
I decided to go for it.
Wow, that's awesome. And so it sounds like it had a pretty formative experience because you had this initial interest and now you have a formal position during your gap year. So I
Mhm.
guess like what were the major takeaways from that experience for those 2 years that you were at this particular job?
Yeah, it was completely transformative and it really shaped the whole rest of the trajectory of my career. I would say that what I found the most cool about that experience was that a very small group of developers who were all physicians by background was able to build systems that were changing the decisions of tens of thousands of doctors across multiple VA systems. And I just thought there was something very cool about that scale of the work that they were doing.
Wow. I mean, yeah, it really puts it into perspective in the sense that you're working on like a macro level where the decisions and the implementations you make impact not just one patient, but
Mhm,
thousands and thousands of patients. So I think that's really cool experience that you had. And so additionally, after you had completed this, you still had the goal of going to medical school. So what was it
mhm.
like applying to medical school?
Yeah. So I think my experience at VA shaped the way I approached med school. All of
Hmm.
my mentors and supervisors at the VA were actually physicians themselves. So I used them as the model for where I wanted to go with my career. Um, in medical school, I would say that I tried to get more involved with digital health just to prepare myself for that future career.
Hmm.
And it was actually pretty early on in med school that I started to toy with the idea of not pursuing residency.
Wow. And can you just define real quick for our listeners, like what does this like nebulous term like digital health even really mean?
Mm. Yeah, you're right. It is very nebulous, and it's quite broad. I would say that um, the most broad definition is digital health is ways to use computers to assist with delivering care. So it encompasses things like using the electronic health record and applying applications there. So clinical decision support falls into that category.
Hmm.
Then there's also patient-facing applications, so things like wearables that continuously monitor certain, biometric signals and things like that, both to educate the patient and to educate their clinicians. Falls into digital health as well. And then now there's kind of a whole new world opening up with respect to AI applications, both for patients and physicians.
Absolutely. And we're definitely going to get into more of that in a little bit with the podcast. And so you're definitely right. I think it's something that's growing, kind of exponentially at this point. And it's really cool to see like the intersection of medicine and clinical practice. And you're kind of at the frontier of all of that. And we'll get into that in just a second. But let's jump back to medical school. And you got
Mhm.
involved initially as an M1 at Aikido Labs. Is that correct? So
Yep, that's right.
what did you learn from working with this startup company, and how did it kind of change your outlook with doing residency? You kind of prefaced that.
Yeah, I think that was, one of my first experiences with a startup. Um, and I got to really get some hands-on experience with operating a startup of that size, with doing very hands-on work that was actually not clinical at all. It was things like managing social media or writing thought leadership pieces. Akita Labs at the time was providing a smart on fire, or actually not smart, just fire-based API. This was back in 2014.
Hmm.
Um, to enable third party applications to connect with the electronic health record at various hospitals. So I learned a lot about interoperability, which means the ability to take an application and have it work the same way, no matter what the underlying data is, what hospital, what EHR it is, which is actually a big problem in the digital health field. So I learned a lot about that, and um, started to see that there was interesting work to be done that would support clinicians and clinical practice that was not directly clinical.
Wow. I mean, I think that's incredible. You kind of got like almost a business background to some degree with this too, where it like almost like an informal master's of a business administration in that sense, where you got this really cool exposure to a lot of the behind the scenes stuff that goes into running a startup company on top of
Yeah.
the very technical side of things too. Is that right?
Yeah, I would say my experience M1, M2, I didn't probably quite achieve in MBA level of, of education, but definitely, definitely maybe an undergrad level of business acumen. And I certainly was exposed to a lot more of the technical sides of, big problems in digital health today.
And so after working in Aikido Labs, you were pretty much hooked at this point where you're thinking, I need to explore this opportunity a little bit further. I'm not sure if residency is necessarily the best path for me. And so
Mhm.
what did you necessarily do about that?
Yeah. So as I mentioned earlier, fairly early on in med school, was considering not doing residency. Before I fully committed to that decision, I wanted to make sure that I wasn't experiencing some grass is greener syndrome or something like that.
Hmm.
And I also wanted to build my skills a bit more to give myself the confidence that I could get a position that was fulfilling for me after med school without doing residency. So, what I did was I actually took 2 years off between third year and fourth year and worked at another startup. This one was called the Human Diagnosis Project. And actually, that took me to Washington, D.C., where I still am.
Wow. So what is this human diagnosis project, and how did you kind of come to the decision? Like obviously you had an interest of, going forward with this opportunity, but how did you
Mhm.
kind of convince your peers, your faculty and family like that, hey, I'm going to step away from medical school?
Mhm.
It's kind of like no one does that kind of thing. And so I think it's really cool that you had the courage to kind of make that initial step. So how did you kind of navigate that situation?
Yeah. Well, actually, the initial step away was quite easy because there were existing frameworks to do it. So
Hmm.
I was framing it as a research year. And I actually got research year funding from my school to do this or pursue this opportunity for the first year. And I was able to do that because in my role, I was involved in some academic research studies. We were partnering with UCSF, and I was leading those studies and was able to produce some publication from that, which met the requirements of a research year from my school.
Hmm.
So that initial step away was pretty easy, and people kind of understood, oh, research year. Um, though it was really another startup experience. Then I was loving it so much that I decided to stay out a second year. That was a little bit more difficult to navigate, but I would say that my school was very accommodating. I explained what I wanted to do, and um, they, it hadn't necessarily had a lot of experience with people doing something similar, but they were very accommodating in terms of extending my leave of absence. Um,
Wow, that's awesome. So was it considered like a formal leave of absence at that point, or and then they were just willing to take you back at that, like afterwards?
yes. Yeah, at
Okay, so
that
that's
point, it was a leave of absence.
wow, that's awesome. And so also like it's kind of interesting that you bring this up because like I get a lot of like, pharmacy consultation questions, like are quote unquote like breaking the news that individuals in the pharmacy community want to switch into medicine. And
Hmm.
so, there's often like a palpable tension when you're kind of doing
Mhm.
this. And I think a lot of people like kind of experience this because like general consensus is like a lot of people are uncomfortable with making those switches because of all the unknown, factors that go into that. So how did you kind of
Mhm.
explain that to your peers? Like, oh, I'm taking another year off and so on.
I just said I'm having the greatest time, and this is a thrilling line of work, and I don't want to stop. It's an exciting time for this organization. So I think people were quite supportive in terms of my friends and family as well. The school was also quite supportive, and I'm very lucky that they were that way.
And, speaking about the school itself too, I guess like why do you think there's so little information about like alternative careers in the current medical education system as a whole?
That is a good question. And I think it makes sense that it is that way. I think medical schools are designed to produce practicing physicians, clinicians, and that's what they're built for. So, I think it makes sense that there isn't a lot of focus on alternative careers. But, these days, the lines between clinical practice and technology and other fields are all sort of blurring. And I think the role of a physician is evolving, especially given new technologies that are available now that may be able to alleviate some of the work that they had been doing previously.
Hmm.
So I think now is a good time for educational institutions to kind of reevaluate what their curriculum looks like and how they're preparing their students for the future.
Absolutely. And I think that's such a great point too, is like we don't necessarily look back at all of the new changes that are coming. Like a lot of the schools are trying to adapt, but they're not necessarily, they're maybe improving the curriculum to some degree
Mhm.
and kind of adding new diagnoses and new kind of approaches to clinical practice, but they're almost
Mhm.
leaving out some of these, more, I guess, like obscure kind of pathways that I think a lot of people would benefit from hearing about.
Mhm.
But so again, last question, I guess, related to like the human diagnosis project. It was so good that you ended up going back for a second year. So like what was, so formative and so exciting about this particular project that you were involved in?
Yeah. So the mission of the Human Diagnosis Project was to basically democratize medical expertise, particularly around diagnostic decision making. So basically, make it so that anybody anywhere could access the most specialized knowledge of diagnostics because of AI. And this was a long time ago. This was in 2017. So I'm actually not sure. I haven't kept up with the company and what they're doing today.
Hmm.
And technology was also at a different point then than it was now. So at the time, I was very motivated by that mission, and I was very excited to be part of something that I thought was just so much where the puck was going, and could really change the conversation about the way that medicine is practiced um, and all that.
Very cool. Very cool. And so after you had kind of finished that experience at that point, you then came back to medical school. And what was it like kind of transitioning back into the clinical realm when you had been so kind of like hands on with all this like technical work? Was it challenging or?
Yeah, well, luckily, I had done all the hard parts of med school already. So I had done all the core rotations. I had taken step one and step two.
Hmm.
So all I had left were electives. So it actually was not too difficult of a transition. I, in fact, really tried to soak up those last few clinical experiences because at that point, I was 100% sure I was not applying to residency. And these were my last opportunities to really work in a clinical capacity.
Wow. That's so cool. And also, when I came across while I was looking through your application and your profile, you obviously opted to complete a Stanford Biomedical Informatics certificate. When did this occur, and how did you come across this in particular?
Yeah, this occurred over time. I started it when I was at the Human Diagnosis Project
Hmm.
because part of the work we were doing there involved managing biomedical ontologies, which is like a structure for categorizing different medical concepts and how they're related to each other. This was important to the way that the organization was planning to develop their decision making system. And I wanted some more formal education in how to do that. Um, I looked up ways to do that, and the Stanford Biomedical Informatics program is actually um, kind of the home base of where the ontology tool we were using was built. So it was no better place to learn about it than there. And I decided instead of taking one course, why not go for a certificate, beef up my technical skills. So I kind of did one course at a time over the years, whenever I had sort of extra bandwidth.
Wow. And so you kind of like piecewise it through and kind of built up your experience like as you needed it essentially.
Hmm.
So that's
Hmm.
super cool. And, obviously informatics is a growing field at this point in time. So for any of our listeners who wanted to get more involved with this particular practice, what actionable steps do you think they could do right now to get involved in the same profession?
Yeah, well, it depends on what stage of your career you're in. Folks who are in residency are probably aware that there is a new clinical informatics fellowship, which I think is 1 to 2 years after your
Hmm.
core residency. That is a great way to get involved with hospital-based informatics and a great way to transition onto, say, a CMIO type track. I would say for folks who are in medical school or maybe earlier, there are lots of startup opportunities that you can seek out. And my recommendation there would be to not get discouraged if you don't see something listed on a website as a role or an internship. I would say don't be afraid to just reach out and try to connect with somebody on LinkedIn. Folks with clinical backgrounds are pretty likely to respond. So I would say don't be afraid to take that step and try to figure out ways you can start to get involved.
Absolutely. I couldn't agree more. I mean, obviously, like cold emailing and cold outreach, like it's not
Mhm.
necessarily the most enjoyable process, and you'll probably get a lot of no's or a lot of, no one answers you at that point. But all it takes is for that one person to answer and say, hey, I respect what you're doing. I did the same thing when I was in your position. And so I'm
Mhm.
going to give you a shot. and all of the like all those opportunities can open up just off of one, email that you didn't think was going to go anywhere. So I think that's really good advice. And it's funny, it makes me think back to episode 27 with Dr. Bokobo, and he was sharing on that episode about how he had reached out through the MD Plus community, and
Mhm.
just a casual email that he sent out to try and help with some kind of workflow in the hospital, and it ended up turning into a venture capital fellowship opportunity
Wow.
where he was there for a couple months, and it was really cool. So you never know until you ask, I suppose, is kind of the
Yeah,
conclusion of that.
exactly. And
Alrighty.
then I guess one more thing to add on, there's kind of
Sure.
more formal organizations, associations, if you want to start following the news and understanding the spectrum of informatics field that is out there. American Medical Informatics Association, AMIA, is a good organization to look up and maybe subscribe to. There's a number of Slack communities, I think, as well there.
Perfect. I think that's great advice, and I'll also drop that in the show notes for anyone who's interested.
Great.
And additionally, after you had finished medical school at this point, you had foregone residency. So, what were kind of the next steps for you? I believe you took on this like prestigious White House Presidential Innovation Fellowship at the VA's Office of Chief Technology, working in the Chief Technology Officer Suite. So,
Mhm.
how did that kind of come to fruition, especially considering you had a previous job working at the VA? I think it's kind of funny how everything came full circle for you.
Yeah, yeah, and actually, we can get to this later, but I'm at the VA again now. Um,
Three times.
yeah, 3 times. So during my 4th year, when I was doing my electives, I had enough spare time to be job searching, and I was, pursuing that pretty hardcore during that time.
Hmm.
I was mostly actually seeking startup roles because that's what I had experience in, and I think it was on Angel List, which is now called Well Found, but Angel List used to be a startup job board. I am fairly certain that is where I saw the posting for the White House Presidential Innovation Fellowship. It was not something I considered or sought out or knew about, but I saw it on a startup job board. Um, Nobody else thinks that that was a place that this job was posted. I've talked to people in the program. They're like, "Who did that?" I don't know. I'm sure that's where I saw it. Um, And I ended up with 2 options: the Presidential Innovation Fellowship, which is a program that takes technologists from the private sector and brings them to the government to modernize practices,
Hmm.
versus a clinical informatics startup opportunity. In the end, I decided to go with the Presidential Innovation Fellowship just because of its potential to expand my horizon, expose me to types of people I wouldn't have met otherwise. It's not a clinical specific fellowship. In fact, I was the only clinical background person in my cohort, and I'm glad I made that decision. It was definitely the right decision.
Absolutely. It definitely you probably experienced some growing pains at that point,
Mhm.
considering like you're a little bit out of your element, but because of
Mhm.
that experience, you are much more well-rounded as an individual, kind of expanding your clinical experience, but more so into into the technical realm as well. And so obviously having worked at the VA for 2 years, and this is your second time at the VA, what were the major takeaways from this expanded experience as a fellow?
Yeah. So this time, rather than being at a local VA, I was at VA central office as part of the Office of the Chief Technology Officer. So I had a much greater opportunity to impact VA at scale, but I also had many more stakeholders and many more offices to coordinate with in order to get anything done. So that was a little bit of a growing pain to begin with. But I think my takeaway was that as long as I had a clear message and a clear value that I was trying to deliver, if I kept talking about it enough, and if I wrote it down on paper and circulated it enough, slowly pieces would fall into place. And the mission driven folks at VA would sort of all get on board and do what they could do to help move the machine forward.
Wow, that's so cool. And so basically this like kind of expanded responsibility and similar to what you're doing at your previous position, but at a much larger scale,
Hmm.
working with a lot different, more technical kind of, I guess, interoperability engineers and whatnot.
Hmm.
So I
Exactly.
think that's really cool. And so after you finished this experience up, you also spent some time at Accolade Incorporated as like a product team lead.
Hmm.
And you specialized in building like tools to basically minimize like documentation, which of course we know is the bane of a lot of healthcare professionals' existence at this point in time. So, this kind of also introduces the concept of healthcare burnout. And
Hmm.
obviously, like I mentioned, excessive documentation is not super fun and resulting in a very high rate of burnout in America. So, from your perspective at Accolade and your training experience, what do you think we can do to realign ourselves with what is really important, that being patient centered care?
I would say that my experience at Accolade and in any clinical setting has really solidified um, my belief that administrative burden is a gigantic problem. If we were to remove that, there would be many, many cascading benefits. And I would say that, you know, one that I think about a lot today, I'm at the VA again, working on clinical decision support and also reducing provider burnout, is that you can offer many clinical decision support tools, apps, devices, and all of this stuff that's meant to improve care. And theoretically, it can. But if someone just does not have cognitive space to look at another piece of information or to open another app or do something like that, it won't get used. And if there's no adoption, there's not going to be any impact. So I think by reducing administrative burden with, for example, things like AI medical scribes or automated drafting of secure messages back to patients, I think that can free up a lot of cognitive space for physicians to kind of function at a higher level and take advantage of more advanced technology that they just cannot deal with today.
Awesome. And it's kind of funny to think about like how we developed all of these technology, components and building out these EMRs for the purpose of minimizing burnout. And yet we've built this colossal monstrosity that has resulted in the complete opposite of what we were hoping to accomplish. And so
Hmm.
it sounds like we need to it almost grew too fast for us to really make the adoptions that we needed to kind of improve the workflows. And it sounds like you're right. Like I think we need to incorporate more AI to ensure that we don't have to do the monotonous documentation every single day. And I think that's really important too. You mentioned like even if we have some of these tools added in, if we don't have the bandwidth to accomplish it or to
Hmm.
even like look at it, we're not going to get anywhere with it. So I think that's also important. So more so just less is more at this point.
Yeah, and I would say, EHRs weren't necessarily designed to reduce burnout. I think a lot of what they do is support billing workflows, and documentation requirements also support billing workflows. So, for better or for worse, that's how the system is functioning today. And if we can automate a lot of that documentation that's required for billing, then that's great. So, yeah.
Awesome. And so, let's take things up to the present at this point.
Mhm.
What are you doing necessarily now at the VA, and how is this position that you're holding currently a little bit different than maybe some of your prior experiences?
Mhm. So now at the VA, I'm at a new office, also at central office, called the Office of the Chief AI Officer. It is a newly formed office that was mandated by an executive order that was put out by the Biden administration in October. And as part of the Office of the Chief AI Officer, I'm responsible for determining priority use cases at VA for AI. And a priority use case is one that we believe will have enough impact such that we should support an enterprise offering of it. So they're not
Uh,
the only use cases VA will pursue, but they are the ones that the central office wants to support.
Awesome. Awesome. And so, also, kind of in your spare time, too, I hear that you also created your own company, Alt MD. Can you tell us what kind of services you hope to offer and what you're hoping to accomplish with this new company?
Sure. So I would say at this point, it's not a company. It's probably better classified as a volunteer organization with one volunteer, me. Um, but basically, the mission of AltMD is to empower physician trainees to pursue alternative careers in medicine, whether that be fully non clinical or clinical plus. I've got a couple things brewing, but basically, this all ties back to sort of my story that we were talking about earlier. I
Mhm.
think something that's really helped me in my career was the opportunity to experience digital health work hands on during med school before I had to decide about residency. And I find that a lot of med students who are in similar positions that I was in med school, interests outside of clinical medicine, have trouble connecting with those opportunities. So, what I'm working to do with AltMD is to utilize existing elective frameworks at medical schools to provide some of those alternative opportunities.
I think that's so interesting, especially since like I just recently stumbled upon like the MD plus community. And I'm
Hmm.
sitting here thinking, like, oh my goodness, if only I had known about this 3, 4 years ago, like I would have been so much more involved. I think it would have just like opened my eyes to a lot more of the opportunities that are available to a lot of people.
Hmm.
And, I think you're right, like in the sense that the traditional medical school framework doesn't work for everyone. And I think we need to acknowledge that. And it'll lead to a more fulfilled clinical base of,
Hmm.
physicians that get through. The ones who end up wanting to take these non-traditional paths are going to be much happier and they won't be, burnt out working in clinical practice. So I think that's going to be a fantastic resource down the line. And I'm really excited to see what you're able to produce.
Awesome. I'm excited as well.
All righty. So we've gotten to the end of our interview at this point, and we're right now about to ask the famous 3 questions. So these are the same questions we ask every guest who's on the podcast, and so we'll just jump right in. So how do you maintain a work-life balance in the demanding profession that you hold? And what kind of tips do you have to kind of achieve this same balance?
Yeah. Well, I guess my answer to this one is not groundbreaking. It's not exciting either, but I actually block off time on my calendar for hobbies and outside of work activities. So I go climbing a couple times a week, and there's a block on my calendar twice a week that says climbing. So I think scheduling in those intentional times to do something not work related has been really helpful for me, and it's been working.
That's awesome. So you're basically reorienting your priorities in the sense that you are putting, the things that are most important to you first and making sure that your calendar that is always kind of incorporated. And then everything else that needs to get done falls kind of to the wayside and is scheduled around that. And I think that's such an important mindset to have these days. And so building off that too, what kind of recommendations do you have for students or graduates at this point who are interested in pursuing a similar career as your own?
Yeah, I would say try to get hands on experience as early as possible. I think a lot of students I talk to are vaguely interested in other fields, but they don't have a good way to advance or kind of get more clarity for themselves about what their interests are and what their next steps should be. So I would say try something, get hands on with something as early as possible.
Perfect. And last but not least, what are your personal, professional, or business oriented goals that you would like to accomplish in the next 5 to 10 years?
I would say that 5 years from now, I picture myself still being at the VA. And I picture that we have a very successful AI governance process, and we have impacted the lives of basically every veteran and every VA healthcare provider in a positive way with the AI tools that we've offered. I would also say that I'd like AltMD to be up and running. I don't know what it would look like 5 years from now, but this year my goal is to have one cohort of students go through a digital health internship through this program.
Fantastic. All righty. Well, we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, non traditional careers, or entrepreneurship, check out my website at www.physicianpharmacist.com. Before we let you go, Dr. Yuen, how can our listeners get in touch with you or learn more about you?
Feel free to connect with me or message me on LinkedIn, and you can put that in the show notes.
Fantastic. Well, thank you again for being on the show. I really do appreciate your time today, and I'm looking forward to all the great things that are about to come down the line.
Awesome. Thank you so much for having me.
All righty. Take care.